The circulatory system in mammals operates as a closed loop with distinct roles for the systemic and pulmonary circuits. Explain the differences between these two circuits and how disruptions in each can lead to specific clinical presentations such as cyanosis or edema. Answer: the systemic circuit carries oxygenated blood from the heart's left ventricle to the body's tissues and returns deoxygenated blood to the right atrium. The pulmonary circuit, on the other hand, sends deoxygenated blood from the right ventricle to the lungs for oxygenation and returns oxygen-rich blood to the left atrium. Disruptions: cyanosis occurs when the blood is not adequately oxygenated, often due to issues in the pulmonary circuit such as pneumonia or congenital heart defects that prevent oxygen exchange. This results in low oxygen levels in the bloodstream, visible as a bluish tint to mucous membranes. Edema is often a result of left-sided heart failure, where the heart fails to pump blood efficiently to the body. Blood backs up into the lungs. Pulmonary congestion, increasing fluid pressure and causing fluid to leak from the vessels into the surrounding tissues, leading to swelling. Pulmonary edema. Regulations like the RSPCA Animal Welfare Guidelines stress the importance of early detection and treatment of circulatory issues to ensure animal comfort and prevent further complications. Which behavioral signs in cats indicate acute stress during handling, and what are 3 evidence-based techniques to reduce stress while ensuring safety for both the handler and the animal? Answer: acute stress in cats is often indicated by dilated pupils and ears flattened backward, flicking or thrashing tail, and excessive vocalization like growling or hissing, increased respiratory rate, and overall tense body posture. Techniques to reduce stress include towel wrapping. This provides a sense of security and restricts the cat's movement, minimizing escape attempts and reducing anxiety. Use of pheromones. Spraying synthetic feline pheromones, e.g. Feliway, in the environment can create a calming effect by mimicking natural scents that indicate a safe space. Create a calm environment. Ensure the surroundings are quiet and calm, avoiding sudden movements, loud noises, or stressful stimuli. Slow, deliberate actions help the cat feel less threatened. The veterinary code of practice emphasizes reducing fear and stress during handling, not only for the welfare of the animal but also to prevent injury to both the animal and the handler. MS. Clark brings her dog Max to the clinic for an emergency appointment. The receptionist inadvertently schedules Max during a routine appointment slot, resulting in delayed care. This leads to MS. Clark filing a complaint about the clinic's operations. What protocols should the clinic have in place to manage appointment scheduling effectively, and how should the complaint be resolved professionally? Answer: the clinic should implement the following protocols. A triage system should be in place to quickly identify and prioritize emergencies. Practice management software should be used to track all appointments and alert staff of conflicting bookings or emergencies. Clear staff training is essential to differentiate between emergency and routine cases for accurate scheduling. In resolving the complaint, the clinic should acknowledge the concern and apologize for the error, explain the measures being taken to prevent future occurrences, such as software upgrades or changes in the booking procedure, offer compensation or a follow-up appointment to address any lingering concerns. The Veterinary Surgeons Board guidelines suggest that transparency and prompt resolution of complaints are essential in maintaining a clinic's reputation and client trust. Identify 3 zoonotic diseases commonly encountered in veterinary practice. Describe one method for preventing the transmission of each disease. Answer: 3 zoonotic diseases common in veterinary practice are ringworm, caused by fungi. It can be transmitted through direct contact with infected animals. Prevention includes using gloves and gowns when handling animals known to be infected and disinfecting surfaces. Leptospirosis, a bacterial infection often contracted through exposure to urine from infected animals. Prevent transmission by wearing waterproof gloves and boots and properly disposing of waste. Toxoplasmosis, caused by the parasite Toxoplasma gondii. It is contracted through contact with infected cat litter or feces. Prevention includes proper disposal of litter and hand hygiene after handling cats. The Work Health and Safety Act 2011 outlines the necessary protocols and protective measures to minimize risk to staff from zoonotic diseases. Explain the significance of aseptic techniques in surgery and list 3 practices to maintain sterility during a procedure. Answer: aseptic techniques are crucial to prevent the introduction of pathogens into the surgical site, reducing the risk of post-operative infections. These techniques maintain sterility in both the surgical environment and on instruments. 3 key practices: sterile draping. Covering the patient with sterile cloths ensures that only the surgical area is exposed to the instruments and the surgical team. Proper gowning and gloving. All surgical personnel must wear sterile gowns and gloves to prevent contamination from their clothing or hands. Autoclaving. Sterilizing all instruments using an autoclave guarantees that bacteria and viruses are eradicated before use. The Australian Veterinary Sterile Practices Guidelines outline these standards to ensure the highest level of infection control during surgery. Describe the principles of radiation safety for veterinary staff and explain how the inverse square law is applied in practice. Answer: radiation safety involves minimizing exposure to ionizing radiation by limiting exposure time by efficiently completing imaging procedures, maximizing distance from the radiation source, using shielding such as lead aprons and barriers to protect personnel. The inverse square law states that the intensity of radiation decreases with the square of the distance from the source. For example, if a veterinary technician doubles their distance from the source, radiation exposure is reduced to a quarter of its original intensity. This principle is vital in ensuring the safety of staff working with diagnostic imaging equipment. The Radiation Protection Act mandates these safety protocols to minimize radiation risks in veterinary practice. What are the critical steps to stabilize a dog with suspected anaphylaxis following a bee sting? Answer: the critical steps to stabilize a dog with suspected anaphylaxis following a bee sting are: administer oxygen to support respiration and ensure adequate oxygenation. Administer epinephrine 0.1 mg to counteract the allergic reaction and improve circulation. Start IV fluids to maintain blood pressure and prevent shock. Monitor vitals continuously and administer antihistamines or corticosteroids if indicated to reduce the severity of the allergic reaction. According to the RECOVE guidelines, swift and efficient management of anaphylaxis is crucial for improving outcomes in emergency situations. Explain the clinical signs of dystocia in dogs and the initial steps a veterinary nurse should take. Answer: clinical signs of dystocia in dogs include prolonged labor with no progress, where strong contractions continue for over 30 minutes without delivering a pup, foul-smelling discharge or excessive bleeding, signs of distress such as panting, whining, or visible pain in the dam. Initial steps: notify the veterinarian immediately to assess the situation. Prepare for surgical intervention such as a C-section if required. Maintain a calm and warm environment for the dam and provide comfort measures until the veterinarian arrives. The Code of Practice for Breeding Dogs guides proper management of reproductive health and procedures. In veterinary nursing, what are the key steps to explaining a complex medical diagnosis to a client who appears anxious and has limited medical knowledge? Answer: when explaining a complex medical diagnosis to an anxious client, start with empathy and reassurance. Acknowledge their concerns and assure them you are there to help. For example, say, "I understand this can be overwhelming. I'm here to walk you through everything." Simplify medical terminology. Use layman's terms and avoid jargon. Instead of a hypothyroidism, say an overactive thyroid gland. Break information into segments. Explain step by step. Start with the condition, its implications, treatment options, and prognosis. Use visual aids. Diagrams, videos, or physical models help clarify complex ideas. Encourage questions. Foster an open environment where clients feel comfortable asking for clarification. Provide written materials. Handouts summarizing key points ensure they can review the information later. Guidelines referenced. Veterinary Client Communications Handbook emphasizes clarity and empathetic communication. Describe the steps and ethical considerations involved in processing a payment plan for a client who cannot afford immediate full payment for their pet's care. Answer: steps in processing payment plans. Initial assessment. Understand the client's financial situation without judgment. Propose payment options. Offer structured installments with clear terms. Document agreement. Draft a formal payment agreement specifying amounts, due dates, and consequences of non-payment. Secure consent. Ensure the client signs the agreement after understanding its terms. Ethical considerations. Transparency. Be upfront about all costs, including interest or late fees. Confidentiality. Protect the client's financial information. Fairness. Avoid discriminatory practices and ensure consistency in offering payment plans. Animal welfare. Balance financial constraints with the animal's urgent medical needs. Guidelines referenced. Australian Veterinary Association (IVA) Guidelines on Financial Practices emphasizes client fairness and animal welfare. Mrs. Thompson has brought her elderly cat, Smokey, for a routine checkup. During the consultation, you discover that Smokey has advanced dental disease requiring immediate treatment. Mrs. Thompson seems upset and mentions she has limited income as a pensioner. She asks you, is this treatment absolutely necessary? What should you do next to handle this situation effectively? Answer: acknowledge concerns Begin with empathy. Say, I understand this is unexpected and can be a lot to take in. Let's discuss what's best for Smokey. Explain the medical need. Emphasize the importance of the treatment for Smokey's quality of life. For instance, untreated dental disease can lead to pain, infection, or systemic health issues. Discuss financial options. Provide a cost estimate and discuss options such as payment plans or stage treatments. Offer low-cost alternatives if feasible without compromising care. Reassure. Explain that you'll work with her to prioritize Smokey's health within her means. Follow up. Provide a written care plan and schedule a follow-up appointment to reassess progress. Guidelines referenced. Animal welfare standards and guidelines. Australia highlights the duty to prioritize animal welfare. AVA Code of Conduct emphasizes ethical client and animal care. What are the essential components of a successful marketing strategy for a veterinary practice? Answer: the essential components include identify target audience, determine key demographics such as pet owners in specific locations or with specific pets, utilize digital marketing, leverage social media platforms, a user-friendly website and email newsletters to engage with clients, loyalty programs, introduce rewards for repeat visits or referrals, community engagement, host events like free wellness clinics to build trust and visibility, track metrics, measure engagement and conversion rates to refine strategies. Relevant rules and guidelines. Consumer law in Australia ensures transparency in advertising claims. AVA ethical guidelines requires ethical representation of services in marketing. Mr. Gupta, a regular client, has been given a significant invoice for his dog Luna's surgery. He expresses frustration, claiming he wasn't informed about the full costs beforehand and feels misled. What steps should you take to resolve this dispute while maintaining professionalism? Answer: remain calm and empathetic. Acknowledge Mr. Gupta's frustration and thank him for bringing it to your attention. Review records. Check the client file for cost discussions or estimates provided during consultations. Clarify miscommunication. If no prior discussion occurred, apologize and explain that clarity in cost estimates is a priority moving forward. Propose solutions. Offer a payment plan or discount if appropriate. Provide a detailed breakdown of the charges to justify costs. Learn and improve. Use this as feedback to ensure better cost communication with clients in the future. Guidelines referenced. Australian Competition and Consumer Act requires transparency in pricing and fair treatment of clients. AVA guidelines on client relations advocates resolving disputes professionally. Discuss the legal and ethical considerations when handling complaints from clients in a veterinary clinic. Answer: legal considerations. Compliance with consumer law. Ensure all complaints are handled in line with the Australian consumer law, providing remedies if services were not as promised. Confidentiality. Protect client and patient information during the resolution process. Ethical considerations. Listen actively. Give the client space to express concerns without interruption. Resolve quickly and fairly. Aim for a resolution that satisfies both parties while adhering to clinic policies. Transparency. Acknowledge mistakes and provide honest responses. Guidelines referenced. AVA Code of Professional Conduct highlights ethical handling of complaints. Samantha, a first-time pet owner, has brought her puppy for vaccinations. During the consultation, you explain the importance of vaccinations for her pet's health. However, she expresses concerns about the potential side effects and asks if it's possible to delay the vaccinations. What is the best way to address Samantha's concerns while maintaining her confidence in the vaccination process? Answer: the best way to address Samantha's concerns while maintaining her confidence in the vaccination process is acknowledge concerns with empathy. Start by acknowledging Samantha's worries. Say, well, I understand you're concerned about the side effects, and it's great that you're thinking about your puppy's well-being. Explain the importance of vaccination. Discuss how vaccinations are crucial for preventing serious and contagious diseases like parvovirus, distemper, and kennel cough, especially for young puppies who are more susceptible. Address side effects honestly. Explain that while side effects are rare, they are typically mild, e.g., slight fever or lethargy, and temporary. Offer examples of common reactions and their duration. Emphasize the risks of delaying. Explain the potential risks of delaying vaccinations, such as increased vulnerability to preventable diseases. Offer solutions and reassurance. Reassure her that you will monitor the puppy closely after the vaccination and provide contact information in case she has concerns later. What are the key factors that veterinary nurses must consider when managing a clinic's financial operations, especially in terms of processing invoices and maintaining accurate records? Answer: accurate billing. Ensure that every service and product is accurately billed to the correct client with clear descriptions and appropriate pricing. Timely payments. Monitor and follow up on overdue invoices to ensure cash flow remains stable for the clinic. Implement a system to track outstanding balances. Record keeping. Maintain accurate and up-to-date records of all transactions, including sales, payments, refunds, and discounts. Regulatory compliance. Ensure that all financial processes comply with relevant tax laws and financial regulations, such as the Goods and Services TIC GST in Australia. Confidentiality. Protect client financial data in accordance with privacy laws and clinic policies. Guidelines referenced. Australian consumer law requires clear and honest communication regarding financial transactions. AVA Code of Professional Conduct emphasizes confidentiality and transparency in financial matters. What is the role of a veterinary nurse in educating clients about the importance of preventive care, such as flea and tick control, and how should this information be communicated effectively? Answer: educating clients on preventive care. The veterinary nurse should provide detailed information on the risks of flea and tick infestations, including potential health problems such as skin infections, anemia, or tick-borne diseases like Lyme disease. Personalized advice. Tailor the conversation to the pet's specific needs, considering factors like age, breed, lifestyle, and risk of exposure to parasites. Provide practical solutions. Offer a variety of flea and tick control products, e.g. topical treatments, collars, oral medications, and explain how each option works, its effectiveness, and how to use it properly. Emphasize consistency. Explain the importance of regular treatment and the risks of missing doses or delaying treatments, especially in high-risk areas. Reinforce the importance of annual checkups. Remind clients that annual vet checkups are essential for early detection of any health issues related to fleas and ticks. Guidelines referenced. AVA Client Education Guidelines. Australian Pesticides and Veterinary Medicines Authority (APMA). Tom, an established client, brings in his dog Max for a routine health check. Upon examination, you notice that Max has severe tartar buildup and gingivitis. Tom insists that Max has always been healthy and claims that he doesn't want to spend money on dental treatments, suggesting a wait-and-see approach. How should you proceed in handling this situation while considering Tom's concerns and Max's health? Answer: acknowledge Tom's concerns. Begin by acknowledging Tom's perspective. Say, I understand that you feel Max has been healthy and it's good to hear that he hasn't had noticeable problems. Explain the risks of delay. Discuss the potential risks of untreated dental disease, including pain, infection, and the possibility of it affecting Max's overall health, e.g. heart or kidney disease. Provide education on dental health. Explain that dental disease is common in dogs and can be prevented or mitigated through regular dental care. Offer simple home care options like brushing Max's teeth or dental chews if Tom prefers a less invasive approach. Offer solutions. Present options such as scheduling a dental cleaning or providing a cost breakdown. You could also mention payment plans or more affordable alternatives. Reassure and educate. Reassure Tom that dental care is vital for long-term health and that early intervention is more cost-effective than waiting until a more serious problem arises. What are the essential steps for a veterinary nurse to take when managing client accounts and payment plans in a veterinary clinic? Answer: the essential steps are account setup. Ensure each client's account is created with accurate details, including their contact information, pet details, and any prior treatment history. This information should be updated regularly for accuracy. Billing transparency. Provide clear and concise invoices that itemize each service or product provided, including diagnostic tests, medications, and treatments, as well as the costs associated with each. Ensure the client understands the payment schedule, especially if a payment plan is offered. Payment plans. When offering payment plans, ensure these are discussed and agreed upon in writing. The payment plan should outline the total amount due, installment amounts, due dates, and interest rates if applicable. Monitor and follow up. Track the payment status regularly and send reminders for upcoming or overdue payments. Follow up promptly on overdue accounts while maintaining professionalism and empathy. Confidentiality and compliance. Ensure that all financial transactions are handled in compliance with privacy regulations, such as the Privacy Act 1988, and that client financial data is kept secure. Mr. Harris brings in his elderly cat, Whiskers, for a routine health checkup. During the examination, you detect early signs of kidney disease. Mr. Harris seems worried, but after the diagnosis, he is reluctant to proceed with any immediate treatment due to the potential cost of managing a chronic condition. How should you approach this conversation with Mr. Harris to ensure he understands the situation and makes an informed decision regarding his cat's care? Answer: acknowledge his concerns. Begin by acknowledging Mr. Harris's worries. For example, I understand that managing a chronic illness in your cat can feel overwhelming, especially when it involves long-term costs. Explain the condition clearly. Provide a clear explanation of kidney disease in cats, including its symptoms, progression, and available treatment options. Clarify that while kidney disease cannot be cured, it can be managed to improve quality of life. Discuss treatment options. Offer various treatment options based on Whisker's specific condition and explain their costs and benefits. This might include dietary changes, medication, and regular checkups. Address the financial concerns. Understand Mr. Harris's financial constraints and explore cost-effective options. Suggest a gradual approach to treatment or provide information about payment plans. Emphasize that early intervention can prevent further complications and reduce future medical costs. Offer reassurance and support. Reassure Mr. Harris that the clinic is there to support him through every step of Whisker's care. Provide contact information for follow-up consultations and answer any questions he might have. You are scheduling appointments for a veterinary clinic. A client calls saying their dog has been lethargic, vomiting, and showing signs of dehydration for the last 24 hours. Another client requests a routine dental cleaning for their cat. How do you prioritize these cases and what factors influence your decision? Answer: the dog displaying lethargy, vomiting, and dehydration is an emergency that demands immediate attention. These signs could indicate conditions like gastrointestinal obstructions, poisoning, or severe dehydration, which could be life-threatening if not addressed promptly. Routine dental cleaning for the cat is not urgent and can be scheduled for a later time. Prioritization in veterinary practices follows the principle of triage. Emergencies are dealt with first to prevent harm or death. Key factors influencing the decision include severity of symptoms. Lethargy and dehydration indicate a potential life-threatening condition. Animal's medical history. Any pre-existing conditions could escalate risks. Time sensitivity. Emergency cases require immediate intervention, while routine procedures have more flexibility. Guidelines from the veterinary triage system recommend prioritizing cases based on clinical symptoms and severity. Triage helps in managing multiple appointments efficiently by focusing on the animals in most need of care. Explain the importance of proper PPE usage in a veterinary practice and describe the risks associated with non-compliance. Provide examples of scenarios requiring specific PPE. Answer: proper PPE usage is crucial in a veterinary setting to protect staff from zoonotic diseases, chemicals, and injuries. Non-compliance with PPE guidelines can lead to infections, allergic reactions, or long-term health issues like respiratory problems from inhaling chemicals. For instance, handling a dog with ringworm requires gloves and gowns to prevent transmission. Specific PPE scenarios include gloves and gowns during animal examinations, especially when handling sick or infectious animals, face masks and goggles when performing dental cleanings or surgeries to protect from aerosols, heavy-duty gloves when handling fractious or aggressive animals to prevent bites or scratches. Veterinary workplaces must follow guidelines from the Workplace Health and Safety regulations, which mandate the proper use of PPE to mitigate risks. The Australian Veterinary Association, however, emphasises adherence to these standards, which reduce the chance of occupational illness and ensure a safe working environment. A client disputes a charge for services provided to their pet, claiming that the procedure was unnecessary. How would accurate medical record keeping resolve this dispute, and what are the critical components of a well-maintained record? Answer: accurate medical records act as evidence to defend against client disputes. They document every aspect of patient care, ensuring transparency in decision-making. In this case, reviewing the detailed records of the pet's symptoms, diagnosis, treatment recommendations, and consent forms will clarify why the procedure was necessary. Critical components of a well-maintained record include patient history, documenting prior conditions and symptoms, examination findings, detailing clinical observations and diagnostic tests, treatment plans and client consent, ensuring informed decisions and agreements are recorded, follow-up instructions, recording any further care or checks recommended for the pet. According to the Australian Veterinary Association, proper record keeping not only protects the veterinary clinic in disputes, but also ensures continuity of care. Legal regulations, including the Veterinary Practitioners Registration Boards, stress the importance of maintaining detailed, legible, and secure records, as it forms the basis of professional and legal accountability. Emily, a veterinary nurse, needs to lift a 35-kilogram Labrador onto an examination table. She decides to lift the dog by herself to save time. What should Emily have done differently, and what risks does improper lifting pose? Answer: Emily should not attempt to lift a 35-kilogram dog alone. Instead, she should have used proper lifting techniques or enlisted help from a colleague. Lifting heavy animals improperly can result in serious musculoskeletal injuries like back strains or sprains, and over time, this could lead to chronic pain and long-term disability. The correct approach involves assessing the situation. Before lifting, determine whether assistance or equipment, such as a ramp or hoist, is needed. Using proper technique, bend at the knees, not the back, and use leg strength to lift, not the back or arms. Team lifting. When the load is too heavy, always ask for assistance. WHS guidelines highlight the importance of ergonomic practices in reducing injury risks. It is crucial for employers to provide training in lifting techniques and ensure staff have access to aids like ramps or hoists for heavier animals. The Workplace Health and Safety Act mandates such practices to protect workers from harm. A veterinary clinic frequently handles stray cats, some of which present with skin lesions suspected to be ringworm. Outline the infection control measures necessary to protect staff and other animals in the clinic. Answer: to prevent the spread of ringworm, which is highly contagious, the clinic must implement strict infection control protocols. This includes isolation. Immediately isolate infected animals in designated quarantine areas to prevent contact with other animals. PPE usage. Staff must wear gloves, gowns, and disposable shoe covers when handling infected animals. Sanitation. Clean and disinfect surfaces with appropriate fungicides after contact with infected animals. Hand hygiene. Frequent hand washing after handling any potentially contaminated animal or equipment. The clinic should also educate staff on recognizing early symptoms of ringworm, such as circular, scaly lesions, and ensure regular screening of all animals. The Australian Veterinary Association (IVA) guidelines stress that strict infection control prevents outbreaks and protects both staff and other animals. Describe how veterinary management software supports compliance with client confidentiality and medical record standards. Answer: veterinary management software ensures that client and patient data is securely stored and accessible only to authorized personnel, protecting client confidentiality. Key features of such software include data encryption. All stored information is encrypted, preventing unauthorized access. Access control. The software restricts access to sensitive data based on user roles, ensuring that only staff members with the appropriate permissions can view or edit records. Audit logs. Any changes or updates to patient records are logged, allowing clinics to track who accessed the records and what changes were made. By using such software, veterinary clinics comply with the Privacy Act 1988 and the Australian Privacy Principles Apps, which require the safeguarding of personal data. The software also supports compliance with the Veterinary Practitioners Registration Boards, ensuring that medical records are complete, secure, and compliant with professional standards. What are the differences between cleaning, disinfection, and sterilization in a veterinary context, and when is each method appropriate? Answer: in a veterinary context, cleaning, disinfection, and sterilization are distinct processes used to manage contamination. Cleaning: this is the removal of dirt, debris, and organic material using detergents. It's the first step before disinfection or sterilization. Disinfection: this reduces the number of pathogens but doesn't eliminate all microorganisms. It's used for non-critical surfaces or items. Sterilization: this is the complete elimination of all microorganisms, including spores, using heat. Autoclaving: it is used for surgical instruments and other critical items. Each process has a specific role in infection control. The Australian standards for sterilization of reusable medical devices require sterilization of surgical tools, while WHS guidelines suggest regular disinfection of surfaces to prevent contamination. A client insists on bringing their dog for a nail trim immediately, even though your clinic has only one slot left for the day. This slot is reserved for emergencies. How do you handle this situation professionally? Answer: it's essential to prioritize emergency cases, so the client should be informed that the remaining slot is reserved for urgent needs. Politely explain the policy, emphasizing the importance of handling emergencies promptly. Offer to schedule the routine nail trim for a later time. It's important to educate clients about the clinic's emergency protocol and why these appointments cannot be rescheduled. Veterinary triage principles prioritize immediate care for animals in critical condition. You can also explain that routine procedures are essential but can be handled once emergencies are attended to. What steps should a veterinary clinic take to prevent the spread of leptospirosis among staff and clients? Answer: to prevent the spread of leptospirosis, the clinic should UPP, wear gloves, boots, and masks when handling animals at risk. Vaccinate at-risk animals. Ensure animals that could be exposed to leptospirosis are vaccinated. Disinfect areas. Regularly disinfect areas where infected animals are housed. Educate staff. Train employees on recognizing symptoms and handling potentially infected animals properly. By following WHS guidelines and infection control measures, the clinic can minimize the risk of transmission to staff and other animals. A client calls in the morning to report that their cat is limping and has not eaten for the last 12 hours, whereas another client requests a routine vaccination for their dog. How do you handle this situation, and what factors do you need to consider when prioritizing the appointments? Answer: in this scenario, the cat's symptoms of limping and anorexia should be treated as an emergency, as these signs could indicate a serious injury or illness, e.g., fracture, infection, or systemic condition. Priority should be given to the limping cat, as timely intervention could prevent further complications. Routine vaccinations for the dog, though important, do not require immediate attention and can be scheduled for a later time. Key factors influencing the decision include severity of symptoms. A limping cat can have a fracture, infection, or internal injury, which requires immediate attention. Risk to the animal's health. Lack of food and sudden changes in behavior can signal a serious condition. Time sensitivity. Emergency conditions need rapid intervention, while routine procedures like vaccinations can be scheduled more flexibly. Veterinary triage protocols stress prioritizing based on clinical presentation. The Veterinary Practice Act also emphasizes that emergencies must be handled promptly.